Okay, so good morning, everyone. Welcome to the Curing Coma virtual symposium. Obviously, we're very excited to have everybody here today. My name is Jose Suarez. I'm the Director of Neuroscience Critical Care and Professor of Physiology and Critical Care Medicine, Neurology and Neurosurgery at the Johns Hopkins University and in Baltimore. And I'm the immediate past president of the Neurocritical Care Society. We do have a great program, and on behalf of all my collaborators and the organizing committee and the Curing Coma campaign, we're welcoming you to this two-day meeting, and hopefully we will learn a lot. We have over 400 registrants, so I think to me, this has been a success. I think with that, the first thing we're going to have is some housekeeping issues for you to keep in mind over the next 2 days. So I'm going to turn the microphone over to Kim Williamson, who will be moderating and helping us out with all the logistics of the meeting for the next 2 days. Kim?
Thank you, Jose. Thank you for attending the 2020 Curing Coma virtual meeting. This meeting is being recorded. If you're disconnected at any point, please reconnect using the same link used to enter. If you are still unable to join, your email invitation includes dial-in information to join via phone. General attendees may ask questions relating to the presentation, submitting comments, or reach out for technical support using the Q&A box at the bottom of your screen. We ask that panelists use the chat box to post their questions. The chat box will also be open for attendees during the break periods. To enable closed captioning, please press closed captioning at the bottom of your screen and select show subtitles. If you do not see the closed captioning box, please look under the more button or the 3 dots. We ask that moderators and the panelists please mute their microphones and turn off the cameras during other presenters' talks. We also ask that you turn on your camera during the designated panel discussion and Q&A session. With that, I will now turn the mic over to Jose. Thanks.
Thank you, Kim. Thank you for those helpful tips. They're going to be very useful for the next 2 days. So with that, I think I'm going to introduce first Jeremy Brown. Jeremy is the director of the Office of Emergency Care Research at NINDS. And he also heads efforts to coordinate emergency care research funding opportunities across NIH, across all the NIH institutes. He also serves as the NIH representative in government-wide efforts to improve emergency care throughout the United States. And on top of that, he's also the medical officer for the Siren Emergency Care Research Network that is supported by both NINDS and NHLBI. We're very grateful to Jeremy, who was sort of our window of opportunity through NINDS. I think Jeremy shared our vision of what we were trying to do here, and he was our champion within NINDS to secure funding for this conference. So, and obviously he collaborated with us to make the collaboration between NCS and NINDS a reality. So Jeremy, I'll turn the microphone over to you for some welcoming remarks.
Thank you, Jose, and good morning or good evening to all of you. When we started planning this conference about 18 months ago, perhaps, none of us, of course, could have imagined that we would be doing this virtually. I had hoped to welcome everybody to the beautiful NIH Bethesda campus, and we'd be sitting in the very impressive Natcher Auditorium, and it would be a different kind of conference. But these are the cards that we were dealt, and the committee who have put together this program, together with the support of the contractors who are running the infrastructure of the program, that has really made this come together. And we should all be very, very grateful to the steering committee for really stepping up and producing what is certainly going to be a program that will have been just as good as if we were seeing you live in Bethesda. Just by way of of how we kind of got here. As Jose said, I'm an emergency physician, and I attended a neurotherapeutic symposium in Rochester in June of 2019. It was a great meeting, and I listened to a talk by Jan Klassen from Columbia about the pitfalls of neuroprognostication. Now, being an emergency physician, I was very used to seeing people at the beginning of their trauma or their coma, but of course, didn't know very much about what went on upstairs in the ICU and in the days following their injury or stroke to rehabilitate them. And this talk really opened my eyes to an area that I felt was ripe for further research. And interestingly, as I was floating the idea with my colleagues at NINDS about putting on some kind of meeting to look at the challenges and research opportunities that coma presents, Jose had independently reached out on behalf of the Neurocritical Care Society to see if NINDS would support a conference. And this happy meeting of minds resulted in what you have today, a conference which is supported financially by NINDS and which is obviously put on with its own support from the Neurocritical Care Society of America. I just want to sort of round things out now by talking about where I see us going. There was a paper published in Intensive Care Medicine just a few months ago by the same Jan Klassen, and he refers to what we have to do before us as coma science. He notes that that most comatose patients die because of a withdrawal of life support and not from what we might call cardiopulmonary arrest. He notes that we have a very poor ability to predict outcomes, that clinical exams are poorly standardized, and that about 15% of acutely injured unresponsive patients have an MRI which can show brain activity in response to a motor command. And this last part really intrigues me because you can find in the popular press and indeed online at some wonderful podcasts what this new area of research where a command is given to a comatose patient to think of something, and that area will light up in the brain and you can actually fine-tune a response to that. I heard a podcast very recently on this just by happenstance in which it's going to the next level, and there's going to be an attempt to actually help people in this comatose situation using their MRI to actually spell sentences. It's very, very early, and we know we're at the very, very earliest stages of this work. So we have a lot of work in front of us to improve what it is that we do with our comatose patients and using the research opportunities that NINDS can offer to really further the whole branch, the whole specialty of coma science. I look forward to hearing from you and to learning from you. And thank you once again for joining.
Thank you, Jeremy, for that kind introduction and welcoming remarks from the NINDS. Now we can hear from Claude Hemphill, who is going to tell us about the Curing Coma campaign. Claude is a professor of neurology at UCSF at the Weill Institute for Neurosciences. He currently holds the Kenneth Rainin Endowed Chair in Neurocritical Care. He's a past president of NCS, and he's obviously in the executive committee of the Curing Coma campaign, and I would argue that he needs no introduction. So Claude?
Well, Jose, thanks for that introduction. So I thought it would be worth spending a couple of minutes introducing folks to the Curing Coma campaign. I know that many of the folks who are part of this symposium, either as panelists or as attendees, are familiar with it, but some may not be. And as Jeremy mentioned, it was really sort of the combination of the NCS and through its Curing Coma campaign and NINDS with Jeremy as our wonderful contact that really gave us the opportunity to collaborate and bring this together. And it's really a thrill to finally be here with all of you and be moving forward. So I'm going to have Malika advance the slides. So next. This came about because the Neurocritical Care Society had a strategic planning meeting regarding research in neurocritical care, partly because of concerns and perhaps dissatisfaction with high-impact interventions that we were lacking. And the theme of this conference was Blue Ocean. And for those of you who are familiar with it, Blue Ocean is a business term that means uncontested market space. But in biomedical science, it may mean insufficiently explored areas with significant potential for high impact new treatments. So there was a lot of discussion, and there were over 150 attendees, and there were a lot of potential avenues to pursue. But really what kept coming around is the most compelling unifying unmet need across neurocritical care conditions was assessing mechanism of acutely impaired consciousness, predicting recovery, and intervening to improve that recovery. And hence the Curing Coma campaign was born. Next. And so this really, we see this as what we're calling a grand challenge. We've used the analogy of a moonshot in order to galvanize and enable folks. But I think it's important that we all recognize that we're really talking about two main aspects. One is enabling breakthrough science, and that's why we're here today. But one of the gaps that we recognize, and really it's a gap in who we are as neurointensivists, is the lack of a link between the acute and the post-acute phase with regard to science and with regard to continuity of patient care. So linking the acute and post-acute areas across a patient's continuum of care from a science standpoint, and what we call creating the Curing Coma community. This is not just about science. This is really about everybody, anybody who has a role with these patients. And when we talk about coma, we use the term coma, but we're really talking about impaired consciousness, coma writ large, if you will. And there's really a role for everyone, certainly scientists who are working in acute and post-acute consciousness, disease-focused clinical researchers, but bedside clinician. If you're a nurse who takes care of these patients, you have a role in the Curing Coma campaign, families, and more. Next. And while the genesis of the Curing Coma campaign was among neurocritical care, it's really clear that it's bigger than any specific area or domain. Next. So we've created this organizational structure within the Curing Coma campaign that sort of aligns with the two big areas, the two big aspects. We have a scientific advisory council that has a number of different working groups. And as we said, the science is the big focus today. But we have a number of modules, 8 different modules planned, 5 of which are currently operational, that relate to implementation or execution of this science, but also bringing together collaborators and engagement, doing prospective studies. And the Neurocritical Care Society, and I'm very proud that the board of directors and the society has put in substantial seed money to get the Curing Coma campaign off the ground. We already have over 125 contributors in these various scientific working groups and modules involved, but we've got lots of gaps, and so we're going to say we need you, we need everyone. Next. Hopefully you saw a paper that came out, our first paper from the Curing Coma campaign that came out from the Scientific Advisory Council several months ago. And what it was the proceedings of a kickoff meeting that happened a year ago, because the Curing Coma campaign and its kickoff is really less than a year old. But this paper, the goal was to frame some initial scientific challenges, not solve the problem, but frame sort of the scientific pillars, endotyping, biomarkers, and proof of concept clinical trials. And you'll see those are going to be delved into in much more detail during this session, as well as other aspects, such as long-term recovery, prognostication large data sets. And we define curing coma as meaning promoting recovery of consciousness through early intervention and long-term support, clearly linking these two areas. Next. And so I just want to make sure folks know about a number of initiatives that are going on with the Curing Coma campaign. Obviously, we're here today for this two-day virtual symposium, and I thank Jeremy and NINDS again because this is a tremendous opportunity. And as he said, we had originally planned this to be an in-person meeting, and when the situation changed, we considered whether to push it off, and it just didn't make sense to do that. We've got to keep moving forward. But we also, in addition to the virtual symposium, we have a planned in-person one-day symposium next May 3rd at NINDS. So please save the date. We're going to hope that circumstances allow us to have that as a follow-up in-person meeting. So this symposium, in a sense, is a 9-month effort. Then I want to make an announcement that we have our first Curing Coma campaign research study, and it is open as of now. It is open as of now, and we need you to be a Curing Coma collaborator. The Come Together research study is, it stands for Coma Epidemiology, Evaluation, and Therapy. And it's a provider survey. It's not patient level data, it's provider level data on understanding how you take care of coma patients. And so please sign up at curingcoma.org. I want to recognize Raymond Helbach and Jennifer Frontera for their leadership in developing this study. And as I said, I believe the study is active and open for enrollment as of 15 minutes ago. So please go to curingcoma.org. It would be great to have everybody who is on this symposium be a participant because you have a role to play. We're fortunate to also be collaborating with NINDS on common data elements, which are beginning, but are officially beginning in October. We've done a lot of pre-work already. And then to announce World Coma Day, which is going to be next March 22nd, an opportunity for us to come together for science, education, advocacy, and celebration. So, Jose, that's what's going on with the Curing Coma campaign, and it's just fantastic to be here today. So thanks.
Well, thank you, Claude, for those nice summary words about the Curing Coma campaign.